Okay, so here we are, the role of democracy in health, page 199. Will not be heard actually. Okay, so let us see what democracy plays as a role when it comes to health. Now, democracy means it is the government which is running, the government is elected by the people. Okay, so now how is this democracy helping health? That means people who are getting the power to rule and govern the nation, they should at the same time be looking after the health, and healthcare facilities should be provided to the people of the nation. Okay, so that is the basic role of democracy when it comes to, okay, and taking care of their health. The art of healthcare in India can be traced back to nearly 3,500 years. That means since then the health concept was quite known to the people. From the early days, ready?
Yes, ma'am.
Okay.
Started.
So okay. From the early days of Indian history, the Ayurvedic tradition of medicine has been practiced. Now, since age old times, the first medical treatment was through Ayurveda. Okay. And it has been since then that we follow the tradition of Ayurvedic medicines being treated on the patients or the people who are not well. Okay. During the rule of Emperor Ashoka, 3rd century BC, that time, okay, schools of learning in the healing arts were created. Healing arts means the basic, like nowadays we have the hospitals and the institutions like AIMS and all, KGMC, where the teaching is done about the medicine. But earlier, there was still, at that time also, there were healing schools where teaching and methods were taught, where people could learn the art of healing others. Okay. Many valuable herbs and medicinal combinations were discovered. Even today, many of those things continue to be used. During his reign, there is evidence that Emperor Ashoka was the first leader in the world history to attempt to give healthcare to all his citizens. Thus, it is India, no doubt, which was the first state to give its citizens national healthcare. So basically, the national healthcare was provided to his people by Ashoka, and it was way back that time. It is believed that it was the first king, Ashoka was the first king to have given the medical conditions, healthy medical conditions to his people. Okay, according to our constitution, it is the primary duty of the government to provide healthcare facilities to all. Health is an important issue for people. There are both public and private aspects of health. So now, ever since then, it has been a rule, and especially now in a democratic country, please sit straight. In a democratic country, it is a rule now that we should be looked after. The citizens of a particular country should have the pleasure of getting proper health facilities from his or her government. Okay. However, healthcare in India is not available to all, while the Constitution supports the view that the right to health is an aspect of our fundamental rights. Now, though it is a fundamental right, that means all of us have the right that we should be given healthcare. But since India is a vast country with immense population, many a times it is not possible. Okay? In a democracy, people expect the government to work for their welfare. This could be through education, health, employment, housing, or the development of roads, electricity, etc. In a democracy, people expect the government to work for their welfare. In this chapter, we shall examine the meaning and problems related to health. Now, Once a government comes to power, people of that particular country expect the government to look after education, road, sanitation, cleaning, building, electricity, water, everything. Clear? And then the constitution also says it that everyone should be imparted the facilities which provide good health. So in this chapter, we will be basically dealing with the health concept, okay, taken up by the governments. What is health? Now, very interesting question. To remain fit, to remain fine, with no physical ailment, no mental ailment, no emotional ailment, that is called health. Let us see it. The saying goes, health is wealth. We all know that. Healthy living is not a difficult thing. It is merely about making small changes in lifestyle, like adding fruits to our diet or having an extra glass of water each day. So now, planning up a way which is healthy, a healthy lifestyle can leave a healthy mind and body. Clear? This chapter is quite easy if you pay attention. Okay. Diseases or illness can really mean a downturn in our lives, but regular medical checkups of family members can easily prevent serious medical problems and help us live a healthy life. So, regular medical checkups are a way in which you can keep a check on the working and on the possibilities that you could remain healthy for a longer time. Clear? So, it is advisable that after a certain time, regular medical checkups should be taken up. Clear? We can think of health in many ways. Health means our ability to measure to remain free of illness and injury. Now, they have given a very well-defined meaning to what health is. It is that freedom of, from any kind of an injury, from any kind of disease, or any hurt, any wound. If you are free from all that, that means you are healthy. Okay. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution-free environment, they are likely to be healthy. Underline clean drinking water, underline pollution-free environment. So these are the two other keywords which keep us healthy if we look forward for it. One must get clean drinking water, isn't it? And a pollution-free environment. That means an atmosphere environment which is free of pollution. So these two are needed, and it is the government's work to look after. Also, it's the people and individuals' work to keep the environment good enough. Okay. Overall health is achieved through a combination of physical, mental, and social well-being. So three concepts, three categories of health are physical health, mental health, and social well-being. Overall, surrounding should be good. Okay? Physical health means your body. Mental health means your thinking procedure and intelligence. Okay? And social health means, or spiritual health means your emotional. Okay? So you can go through the fact file which gives all the three categories. Then put together is commonly referred as the health triangle. Okay? So in your copies, you will draw a health triangle. Okay? You will draw, on top you will write physical health. On one side you write mental health. On the third side you write spiritual health, and you will connect the 3 points. Okay? Now, healthcare in India. Let us see what facilities do we have in India regarding the health. Healthcare in India features a universal healthcare system run by the states and territories of India. So universal healthcare, all universal means everybody, and healthcare means to look after and care for the health of the people. So universal healthcare system is run by whom? By the states and territories of India. That means every state and every union territory of India looks forward that its people should get proper medical health facilities. Okay? The constitution charges every state with raising of the level of nutrition and standard of living of its people and the improvement of public health as among its primary duties. So every state, it is written in the constitution, which is a set of laws. The constitution says that every state, it is the state's responsibility, that means the government's responsibility, the government who's ruling that state at that time, it's his responsibility to look after the health facilities which are provided, and they should continuously work for the improvement of the overall state. Okay. The National Health Policy, underline that, was endorsed by the Parliament in 1983. Please underline the year also. National Health Policy was endorsed. That means it was taken, adopted in 1983. And it was updated. Updated means you must have seen your mobile updates for a better version. So same, whatever facilities were provided in that policy, there were more improved policies which were reimposed in 2002. Is this much clear? In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. Please underline these various services which are needed by the people and it should be provided by the state. There should be hospitals, laboratories, testing stalls, then blood banks, etc., etc., healthcare centers, all they should be there in a state. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat patients. So now, obviously, to run this medical setup, we need people who are skilled in this, right? So for that, we need nurses, doctors, and many other health workers who could work in accordance and make this a success, okay? These facilities are required to take care of us. Now, government hospitals, some of which are among the best hospitals in India, provide treatment at taxpayers' expense. That means even a common taxpayer who's paying his tax, the government hospitals work on that. That means the amount in a government hospital is very less as compared to the private hospital. Okay, if we go for a treatment in government hospitals, they are much cheaper than the private hospitals. Okay, most essential drugs are offered free of charge in these hospitals. The important medicines, in most of the cases, if they are expensive, in government hospitals, you get it for free or at a very low cost. Okay? Government hospitals provide treatment either free or at minimal charges. So most of the time, the government hospitals, either they are charging very less or many a times they are charging nothing. Okay? They're doing it for free. For example, an outpatient card at AIMS, All India Institute of Medical Sciences, okay, one of the best hospitals in India, cost a one-time fee of ₹10, and therefore outpatients medical advice is free. In-hospital treatment cost depends on financial condition of the patient and facilities utilized by him, but are usually much less than the private sector. For instance, a patient is waived treatment costs if he is below poverty line. So now in government hospitals, even this is seen. If a patient is really very poor, then the possibility is that they are treated free of cost. But this only happens in government hospitals, and AIMS being one of the best in India. Yeah? Another patient may seek for an air-conditioned room if he is willing to pay extra for it. Now, in the same patient, if he needs a AC room to stay, then he will be charged heavily or more than what the poor patient is being charged for. Okay, so it depends upon your preferences that you are charged. The charges for basic in hospital treatment and investigations are much less compared to the private sector. Obviously, any test that you do, any blood sample that you give for testing, all these are much cheaper in government hospitals as compared to the ones taken in the private sector. Okay, in private hospitals. The cost of these subsidies comes from annual allocations from the central and state governments. So now if the hospitals are taking so less from you, so where are they getting money? It is the central government or the state government of that state who is giving them these medical colleges, these government hospitals, the aid. Okay? So it is the government hospitals which is basically aided by the central government and as well as the state government. Okay? Okay? India has a large number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. There is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. We will go into more detail on this later on. Our country has money, knowledge, and people with experience, but cannot make the necessary healthcare available to all. In this chapter, we will look at some of the reasons for this. Now, we know that India has been one of the brilliant place where the brilliant minds are. The knowledge about medicines is tremendously good in India. There are n number of doctors. There are many clinics, many private hospitals. That means every nook and corner in India has proper health facility. But then still, what are the basic factors why we are not able to cope up? Why the healthcare is not being taken care of as it should be? So about this, we will deal in the next class. We stop here. Okay? Thank you. Please stop. Advik.